Hi, I am Dr. Virendra Budnoor, consulting orthopedic surgeon with Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in joint replacement and arthroscopic procedures of the knee, hip and the shoulder. A lot of patients commonly ask us whether a ligament tear can heal on its own. Yes, they will heal on its own. Most of the healing is done by the body. But what is very important is which of these ligaments will heal on its own. What we are supposed to do is quantify the nature of the injury. Whenever a patient has injury, usually the patient should take rest, ice fomentation, physical therapy and little bit of non-steroidal anti-inflammatory drugs. If the healing happens, the pain will subside and with good rehabilitation they can get back to their sports. In case the patient has a repeated instance of pain and swelling, he needs to see an orthopedician. Here we examine the patient, advise him a couple of tests depending on our examination findings. The frequent tests which we advise are X-rays, MRI scans and sometimes CT scans. We quantify the nature of the injury as grade 1, 2 and 3. Grade 1 and 2 are usually partial injuries which can be treated conservatively with the help of anti-inflammatory medicines and good rehabilitation. In case the patient has a grade 3 injury where there is a complete rupture of the ligament, these ligaments will usually not heal and they would require surgical procedures. The surgical procedures are depending on the nature of the ligament. If it is an intra-articular ligament like anterior cruciate ligament or a posterior cruciate ligament, we do an arthroscopic procedure which is a keyhole procedure of the joint wherein we reconstruct the complete ligament with the help of tendons harvested from your own body. The fixation of these tendons on either side of the bone is done with the help of buttons or screws depending on the patient's level of activity. If the ligament is outside the joint, it is done by an open procedure which are for the collateral ligaments, that is the medial collateral ligament or the lateral collateral ligament. So broadly, if it is a grade 1 and grade 2 injury, we conserve them with the help of rest, medication, physical therapy. If it is a grade 3 tear, we usually advise them surgery. Surgery will help them in getting back to their sports as early as possible. Thank you.